Welcome to the Apollo Hospital for this press conference. And I'm going to introduce our guests shortly. But one of the themes that will come out of our interaction is how to improve the cardiovascular health of this country by early diagnosis and newer techniques to diagnose heart disease early, to identify people who are at a high risk for heart disease so that we can shift to prevention and reduce the tremendous disease burden our country is undergoing. And the research that is going to take place at Apollo will hopefully contribute to the well-being of our citizens and also to reduce the disease burden on the country. Let me introduce our chief guests. All are known to you. Others on the podium. Dr. Ferid Murad from San Francisco, USA. He's a Nobel Laureate in medicine and physiology for the discovery of nitric oxide. Since many of you have medical background, nitric oxide is a substance that causes dilation or increases the blood flow by improving the circulation. And the discovery of nitric oxide is considered a major historical development in the history of medicine. Some people have compared the discovery of nitric oxide very similar to the discovery of penicillin for the treatment of infectious diseases. Once the nitric oxide was discovered, then the whole cardiovascular disease has been well defined, and importantly, various therapeutic molecules have developed. Very briefly, in a couple of minutes, Dr. Ferid Murad is an MD, PhD. He is a graduate of Case Western University in Cleveland. He did his residency or training at Massachusetts General Hospital, Harvard Medical School, and then he worked at National Institute of Health, and then he held series of appointments at Stanford University, including the chairman of the Department of Medicine there. And then he also was at the University of Texas in Houston and George Washington University, and now he's again back at Stanford. So he has a very large academic contribution to make. I already mentioned to you that not only he's MD, PhD, and a Nobel Laureate, but he has at least 40 doctorates from different countries. Somebody asked recently, Cardiological Society of India, for his CV, and he told me on my face he can't send his CV because too many gigabytes, 700 pages. So he asked me to synthesize it. Subramanian Garu, with great difficulty, I synthesized that 700 pages into a page and a half. So, ladies and gentlemen, we at Apollo are very fortunate by the visit of Dr. Ferid Murad to our city and to our institution. And with those remarks, I'll conclude. Then I'll ask Dr. Manoj Agarwal to make some comments, followed by Dr. Sangeeta Reddy Garu, our Joint Managing Director.
Good morning, distinguished guests and my friends from media. All of us know that cardio diseases have become like an epidemic in India. And we talk about cardiac disease, it's not limited to heart. Actually, the ischemic cardiovascular disease starts from top in the brain. What we see is in form of stroke, then heart attacks. We see gangrenes because of blockage in the leg arteries, blockage in the kidney arteries causing hypertension. So it's a whole plethora of disease. Unfortunately, the number of cases of coronary artery disease and other cardiovascular diseases in India are increasing day by day. And in India, in particular, most of the people who are affected are very young. They have diffuse disease. Young when they are economically very important for the family as well as for the country. So whenever they get affected by cardiovascular disease, it can be a heart attack or they are going for angioplasty or a bypass. It becomes an economic burden for the family and the society. We lose economically. At times we lose the only earning member of the family. So we need to delay or prevent this disease. If not, at least we should be able to diagnose this disease very early before it really affects or causes a heart attack leading to loss of life. There comes the role of Apollo. Apollo in last few decades has emerged as a key research player in the field of cardiovascular disease. If with Apollo, if you look at it, we are at tertiary care hospital, we have been treating patients very effectively. Now we need to change, we need to prevent or at least delay the disease or diagnose them early. In this field, we have a couple of projects. We have been working with Microsoft in form of artificial intelligence, where we will be defining multiple risk factors. We'll analyze 20 odd risk factors. We'll take up a normal population and then see who is going to have heart disease. If we can forewarn them that, oh, this patient is a high risk for coronary artery disease or a heart attack, he will start changing his lifestyle then and there. So we'll be either able to delay or prevent coronary artery disease. If not, worst come worst, we'll be able to diagnose them early. Similarly, we are conducting another study, which is we are measuring basal levels of troponin levels in normal individuals, and we are categorizing them in low risk, moderate risk, and high risk. Based on this, we are going to study these patients over the next 15 to 20 years, and we'll be able to analyze based on these levels. Suppose a person has 0 level and he doesn't develop heart attack, and another person has say 10 nanogram per deciliter and he develops a heart attack. So if such a patient who comes to us with a 10 nanogram, we'll tell them, okay, fine, you need to control your diabetes, you need to take lipid lowering drugs, you need to exercise more. So this way we'll make him move from a high risk level, say 10 nanogram, where he is a high risk level, to a low risk level. So we'll be able to prevent to some extent and reduce loss of life, or at least prevent morbidity. There are many other programs going on, and we are very happy to announce that Dr. Murad, in his capacity as a clinical physician and a pharmacologist, will be helping us in identifying newer research molecules to treat such patients and develop new tests. We were just talking to him about half an hour ago. He suggested if we employ many more molecules like troponin and nitric peptide, nitrates, and identify patients, you will be able to define it better. So this is this, and Dr. Murad will be able to tell you more about it.
As you've heard from Dr. Ram, I've trained in many areas. I was one of the first students in the United States to do both an MD and a PhD at the same time, and then trained in medicine. I knew that I wanted to do research in a clinical department, but do basic research that has relevance to clinical problems, and that's what I do. I love research. I've been at it for a long time. I like to understand how cells communicate with each other. How do they talk to each other? How does one cell regulate the biochemistry, biology of another cell? And it's taken me in all sorts of directions in cardiology, cancer, neurology, and I really love it. It's fun. And as I travel, I share my ideas with colleagues and try to collaborate and help. And this has been a very promising visit here. This is my 6th time to India. And I think we're going to have fun and solve some important problems diagnostically by looking at the molecules that I've worked with and that interest me and what you're interested in. And if we can pick up and diagnose problems early, it's going to be cost effective. It's a lot cheaper to do it that way than take care of them when they're really ill later on. And I was just telling them, one of my sons-in-law, married to one of my daughters, I have a lot of children, is now looking at lipid disorders in children and predicting atherosclerosis in young children. He's now publishing his work and presenting it in American Heart meetings in the US. So I think it's doable. I think there are ways to do it, and it would be very important that we do that, and we're going to collaborate and try to do it.
So first, let me begin by thanking Dr. Murad for just being with us. I think his presence has been inspirational with the kind of background that he has, and I should also thank Dr. Venkatram, who has a very scientific and research bent of mind himself, for bringing and inviting Dr. Murad. We're very happy you're here, Doctor. Dr. Manoj Agarwal, who spoke earlier, is one of our senior cardiologists and laid out the incidence of heart disease, the trauma on the Indian population by having this high percentage of incidence as well as death occurring because of cardiovascular disease. Mr. Subramaniam and Dr. Atul Adania, our Director Medical Services, we will, after this press conference, be sitting down with Dr. Murad to do what we are announcing today. So the first thing I would like to announce that we have invited Dr. Murad to join the Apollo Scientific Advisory Committee, and he has very graciously accepted to become one of our advisors. So I think this is a milestone and a first for us. Once again, thank you, Dr. Murad. The immediate areas of focus, once we get into it, will be number one, to work further using his knowledge, our cardiologist knowledge, our data scientists, and the very large database that we have to launch research in creation of a new biomarker. So we have done biomarkers before, whether they were for glioma or for clopidogrel acceptance. But his novel idea is to do a multifactorial biomarker which will enhance the ability for us to predict a cardiovascular risk patient. And if you understand that this patient has a higher risk, then you can begin lowering cholesterol, lowering blood pressure, monitoring him better, and most likely avert a heart disease. So he said something, when we were talking, which is very important. He said in many countries now, you are seeing a plateauing of the incidence of cardiovascular, and cancer is becoming the biggest killer. In India, while cancer is growing, cardiovascular is still our biggest killer. So we need to capture that by focusing more on the preventive aspect, finding the causative factors, diagnosing early. And the other important thing which he's added is the fact that we must start looking when people are much younger. People imagine that, 45, 50, 60, they start thinking about, a heart health or a heart checkup. His son is doing research on children and their cholesterol incidence. So the fact is that we need a multi-sectorial risk detection, which is the biomarker, which we will be working on. We need to look at further areas because when you have this vascular problem, it not only affects the heart but also creates neurological problems like stroke. So this is a multi-sectorial impact if we do this research right. So the second thing that we're announcing is that we will be focusing on a biomarker to pick up individuals with enhanced risk of all cardiovascular disease. The third thing which he has spoken about, which we will be exploring further, comes back to his original research work in the entire aspect of nitric oxide. So supplements that he has worked on and produced can be used for improved heart health, but also improved metabolic health. So the combination of hypercholesterolemia, hyperlipidemia, diabetes, and other metabolic disorders combined create this enhanced risk. Through research and analytics of the chemistry of, like he said, the cells which fascinate him, which cell messages what, and which cell can change the messaging, therefore keep somebody healthy. For that, he has created this supplement, so we will be discussing how we can bring this supplement to India, which will also improve cardiac health. These are just a few of the many, many things. Every minute he's giving new ideas, which I think is, typical of someone with his intellectual capacity. And so we're very excited. We will first narrow on these and work extensively, but continue to work with him to find other areas where we can positively impact the health of the people of India, of our population, to use this base to therefore then subsequently help the world. So the research partnership will happen between the Apollo Research and Education Foundation and Dr. Murad as an individual or any foundation that he names. Besides that, we will look at other relationships, including working and training with our cardiologists. So in summary, a lot of the extensive and expansive work I have shared with you in these brief summaries, but this is truly a very significant day in the scientific development, and I continue to say that while in India we must continue to enhance the medical infrastructure that we have, we must continue to train more doctors because we need to double our doctors, triple our nurses, and grow by 5 to 7 times our paramedics. So we have to create more infrastructure, but at the same time we should work with science and innovation and prevention so that the number of patients getting sick reduces and we can help keep them healthy. So the way to reach our Millennium Development Goals or the SDG or to create a healthy, happy India is to focus from both sides. One is improve the treatment, detect early. The other is to find ways to reduce the burden of disease itself. So with that, I'm very happy to throw this open for any questions from the media.
So according to your son research on children, what is the outcomes?
Well, it's early. The work is being done by my son-in-law, who's a cardiologist. He works in San Francisco for a large healthcare company, Kaiser Permanente. He's one of their cardiologists. And he has worked in cancer. He's worked in cardiovascular diseases. And a couple of years ago said, I'm going to start looking at children and their lipid metabolism. And he did the right thing. He's now able, I think, to start predicting in young people those that will have problems later with cardiovascular problems. And that's very important because now you can begin to modify behavior, diet, exercise, whatever, much earlier. When I was at Stanford, we were having cardiovascular disease in 17-year-old heart donors. I was surprised. Now my son-in-law is finding potential problems in even young children. And as you've heard, the earlier we can do it, the more likely we're going to help them. We'll lower healthcare costs because as the disease progresses, the costs go up and up dramatically. And I think we might be able to avoid that if we can diagnose very early. Cardiovascular disease, metabolic disease, diabetes, etc.
And we have told you earlier, if you remember, that at Apollo itself, we have done a triple vessel bypass surgery on a 21-year-old. Now there is proven research, multiple papers and data, which shows that Indians are getting heart disease far younger than their Caucasian counterparts. And this is because of a multitude of reasons, whether it's the lifestyle, the behavior, the impact of epigenetics, physiologically the fact that Indians have smaller vessels, a combination of things. But it's very important for us to recognize this fact that some risk factors of cardiac incidence are non-modifiable, which is the sex or your genetic profile, your parents. But many factors are modifiable risk factors, which is the cholesterol, the lipid, the stress, the blood pressure. And as you all know, the Microsoft Apollo cardiac risk profiling, where we analyzed the impact of 21 different factors and brought to the forefront the fact that for Indians, systolic blood pressure has a higher impact than diastolic blood pressure. So it's things like these which will help make the doctors more careful in their ability to guide patients. And in an era where patients have so much knowledge, the self-care will become more.
And something which we don't know, if it is discovered, will be eligible for a Nobel Prize.
Absolutely, good. So you have a good role model. Yes.
One more question, sir. Regarding natural products, pharmacology with natural items, natural ingredients.
Yes.
Nowadays, more discussing on that throughout the world. What is the connection with heart diseases? With any help that medicine will help to this sector?
By knowing these messenger molecules that permit cells to talk to each other. They regulate a lot of biochemistry, physiology, biology. By knowing how the enzymes work in the pathway, we can now give them the appropriate molecules to make more of the transmitter that's beneficial. So I've created a lot of nutritional supplements to make more nitric oxide. And now we're doing the same thing with metabolic syndrome. By understanding the biochemistry, we have other nutritional supplements. And let me tell you one other story. I have a research center in Shanghai studying traditional medicine. I predicted many years ago, I've been doing it for 12 or 13 years, I predicted many years ago that many of your traditional medicines work through my messenger molecules. And that's now true. We've studied 100 traditional medicines, 20 of them work through my messenger molecules. Now we know how to use those TCMs for other diseases, how to make them more effective, more potent, combine them with generic drugs, and use them in a variety of ways. So there are lots of things out there to pursue that will improve healthcare in people. And that's what I want to do.
So, see, the important factor in this is that all of us knew that there are multiple things. Why did the Indian diet put turmeric into food? Paspu. Pratibhojamla paspestam. It has a certain antiseptic activity, but now they also say that curcumin, which is the active ingredient of turmeric, has anti-carcinogen, so it inhibits the cancer cells. So this is what he is saying, that there are, analyze the messenger of each cell. Whether you, once you understand the pattern, you may give a natural supplement, you may give a chemical supplement, but the crux of the thing is to understand that. In our age-old wisdom of traditional medicine, these had been studied over years and these patterns had been deciphered. And therefore traditional medicine formed. Now if you combine science and traditional medicine, you can accelerate the path to discovery and you can implement better cures and caring for people. So it's a very important aspect, and it's a very good question that you asked as well. So once we have firmly established the relationship, we will also add alternate medicine, traditional medicine as part of the scope of the studies.
What Dr. Sangeeta Reddy Garu has said is a reality in 2019. Until recently, there was an artificial separation between natural products and pharmacological products it was an artificial barrier. But many of the natural compounds, in fact, have pharmacological properties.
Exactly.
But we take them as leaves, we take them as bark, we take them as tea. But the same thing when it is converted in a pharmaceutical company, it comes out as a tablet or a capsule. So that the fear people have of medicine